The Michigan City Conservative Action Group, or MC Squared AG, was founded over a year ago to educate and advocate for a meaningful, common sense change to benefit of citizens of Michigan City and surrounding communities. We are a non-political, nonprofit 501c3 corporation. We desire to partner with anyone who wishes to improve this city and help it to reach its potential of being a beautiful, healthy, and prosperous community for all of its residents. For that reason, we are honored to have Dr. Palopoulos, physician and neuroscientist, here this evening. As someone who deeply values our individual liberties and the importance of informed consent, I believe we are in for a vital discussion tonight. We've all seen how much noise and conflicting information surrounds the topic of public health lately. That's why having a neighbor like Dr. Palopoulos, someone who has spent decades in the trenches of high-stakes medicine, is such an asset to our community. He isn't just reciting talking points. He is speaking from a career spent protecting those who literally cannot protect themselves. Here are some of the key points we should look forward to this evening's presentation. Dr. Palopoulos will draw from his his 20 years of experience overseeing the care of children with severe cerebral palsy. Because these patients are among the most vulnerable to respiratory and infectious diseases, he had to master the common sense application of preventative medicine when there was zero margin for error. Having managed continuous nursing care environments, the doctor brings hands-on knowledge regarding how diseases actually spread and the practicalities of prevention that go beyond what you might hear on the evening news. The core objective of this talk is not to tell you what to do, but to equip you with the expertise needed to make your own informed decisions. This aligns with our mission at MC Squared AG to promote personal responsibility and local management. Dr. Palopoulos is a highly distinguished physician whose career has been defined by his dedication to the most medically complex patients in our society. For 2 decades, he served as the primary attending physician for several hundred children with severe cerebral palsy. These patients require 24-hour continuous nursing care, placing Dr. Palopoulos at the center of a high-intensity medical environment where he managed infectious diseases, and it was a daily life-saving necessity. His experience is rooted in extensive clinical experience as well. Beyond his clinical work, he has become a respected voice in medical research by merging his hands-on expertise with a rigorous review of current medical literature. He provides a unique bridge between complex scientific data and the practical common sense applications that matter to families and the general public. And on that note, I welcome you and introduce Dr. Andres Palopoulos.
Thank you very much, Doug. Such a pleasant introduction. Thank you for coming in this evening. Very, very nice to see you here today. Well, this is a picture, a family picture, and that dashing young man standing on the right-hand side is set for greatness, I think. Well, the standing next to me is my sister, and she was a year and a half younger than me. But what you don't recognize in the photograph is that she really isn't able to stand. And my father is behind her, holding her up so she'd be upright. She suffered polio during the last pandemic in North America. This was the year before the vaccine came out. And so I have personal experience of what a vaccine-preventable disease can do to a person, to a family. It had lifelong consequences. And eventually this led to her premature death. So in no way am I an anti-vaxxer, in other words. Now, in this presentation, I want to kind of clarify one very important thing, is that there are 2 different forms of medicine internationally. And I've been fortunate to be exposed to both of them at the highest levels. One is academic medicine, which is the one that writes textbooks, that teaches in medical schools, that runs all of the medical academies and the governmental organizations. And then you have a medicine that's a common sense, provide medical care to patients. These are 2 different forms of medicine. And these have produced a gigantic conflict over this past decade. They really don't coexist at all internationally. Now, just give a little background, in the world of academics, I've been very well trained. I went to the medical school at the University of Chicago, and at that time, that was 50 years ago when I graduated, it was #2 medical school after Harvard, United States. I'm board certified in neurology, child neurology in Canada and the United States. And I've always and continue to maintain a active medical license in the state of Indiana. I've written 79 peer-reviewed publications. Inflation adjusted, I've received $5 million in research grants. Been a peer reviewer for 15 medical journals, grant reviewer for the NIH, FDA, US Air Force. Air Force has a separate medical division. I've headed 2 NIH review panels, one in autism, Alzheimer's disease, and even the Department of Justice asked me to review cases for them for their immunization reaction program. But that's the academic world. The common sense world, I was very fortunate to experience it, and that was at the Mayo Clinic. I was the first person to receive a medical school a fellowship for 3 months to do a stroke fellowship at the Mayo Clinic when I was in medical school, funded by the American Heart Association, and subsequently did my 3 years, did 2 years of adult neurology and a year of pediatrics there. And my exposure there was, the really important exposure was to the senior clinicians, the ones who've had decades of experience in treating patients and their families. And they knew the academics extremely well. They even wrote articles and contributed to the medical literature themselves. But they had a view that was different, that you have to treat the patient in total perspective of the patient and the family. And that's different from a purely academic thing. It's one thing to worry about killing every single bacteria in a petri dish. It's not the same thing as treating a patient who's got a very bad infection and making sure that the entire family is knowledgeable about. 2 different things. And unfortunately, that's gotten very mixed up. Very unexpectedly, this evolved. And for 20 years, I was a medical director and attending physician for a whole host of skilled nursing facilities, primarily for children with severe cerebral palsy. These are all in the Chicago metropolitan area. And these are where they still all exist, and they still have patients there they're taken care of. And most of these years, the total population was about 500 that I was providing all the care for them. It wasn't me that was providing the care. It was the nurses. I was supervising them, training them, teaching them how to do it. And whenever they had any questions, they called me. Many days I was getting 50 calls a day about issues and problems that were there. So it was very intensive, medically intensive care that was being provided. And it was, again, not just neurology, but everything, all the infectious diseases that they were having, how to handle them, when to send them to the hospital, how to treat them, and vaccinations. 2/3 of these patients were gastrostomy tube fed. 1/3 had a tracheostomy, a breathing tube. And we had high death rates from pneumonia. These are very, very disabled children. So extremely fragile with very limited life potential. My job was not just to provide them good medical care, but improve quality of life, to make their existence a little bit better. The thing about what happened during this time period, MRSA showed up, methicillin-resistant Staph aureus. And the world went into a panic. I'm sure it was the same here as it was all in the Chicago metropolitan area. Staph aureus is a bacteria. We are all covered in it. And it very rarely produces any infection. I'm sure no one of you have ever had a Staph aureus infection or have known of anybody. And the thing about the MRSA is that this is the same Staph aureus, there's no difference, same bug, but it happens to be resistant to one antibiotic. And the only people who will get sick from the Staph aureus are if you're really immunocompromised, and then you're at risk for it. And then it's going to be difficult because MRSA, the standard medicine won't work. But the panic was horrid. A child who come back from a hospital, maybe was exposed to MRSA, the ambulance driver and all the attendants will come out in hazmat suits. And the nurses there have to accept this child back into the nursing facility. It was unbelievable. Now, I did not provide the hands-on care for these children. The nurses did. Most of them are young, they're married, they have children at home. Nobody wants to bring home a lethal bacteria that will kill your kids. Nobody wants that. The biggest fear, and the panic was real, it was palpable. If these nurses quit, my children I'm taking care of will die, guaranteed. No one will be taking care of them. So this was a situation, wasn't just simply interest. This was life or death matters for hundreds of kids that I was in charge of. I was able to explain effectively to the nurses. We set up procedures in the centers how to do it, and nobody quit. And we didn't have any change in mortality at our centers. So I was able to handle this entire panic very, very successfully and very intelligently, despite the constant headlines in the newspapers and in the news reports. Now, at one of the facilities, Little Angels in Elgin, Illinois, over time, the antibiotic use became ridiculous to me. I couldn't understand what was going on. Now, when a child was getting very ill and had to go to the hospital, we'd use the local hospitals. I wouldn't go to the hospital to take care of them. The local physicians there would. The infectious disease department at Sherman Hospital started using the strongest antibiotics for everybody. It was just absurd. I contacted them, tried to convince them that you're doing something ridiculous. You don't need to use all the atomic bombs of antibiotics here. It's inappropriate, but they continue to do it. If you're going to use the ultimate atomic bombs, eventually you're going to have resistance to them, and then you have no treatment of any kind. That's very real. Infectious disease department didn't even understand that basic concept. I filed a formal complaint with the hospital administration. They set up a committee to evaluate the infectious disease department. The committee said that what they're doing is ridiculous, reprimanded them, and they changed their policy and they stopped doing this nonsense. Anyway. And just to make one little point, these are basically all public aid recipients. And it's very hard to find physicians who are willing to take on public aid because of the low reimbursement rate. So for me, this wasn't a thing of a lucrative thing. It wasn't whatsoever. It's more of a devotion to caring for disabled children. Eventually, pulled our data together. There's nothing more stark when you're collecting medical research, medical information, than whether you are dead or alive. It's one or the other. There's nothing in between. Okay, really simple. We pulled our data together, and for these severely disabled children, we had the best survival. We still had a lot of deaths take place, but we had the best survival rates in the world, and we published it. Okay, and since then, there have been similar reports coming particularly out of Sweden, and the idea is if you provide good medical care, you'll have better outcomes. And so the proof is in the pudding. We did very good care and we're able to handle, the sort of pandemic hysteria of MRSA that happened. And by the way, during all of this time, we're having monthly Illinois Department of Public Health inspectors coming through there, constantly looking for deficits, constantly having to deal with these inspections and the concerns that they were raising. And for 20 years, we're able to handle all of this very successfully. So I have a lot of experience in infectious diseases and vaccinations. More than probably anybody in Michigan. I'm certain more than any other physician in Michigan City, period. Okay, what's important is informed consent. When you see a doctor and the doctor wants to do a surgical procedure or prescribes you medicine, antibiotic, you should automatically receive an explanation. Why are you giving me this medicine? What is the benefit to me? Why should I take it? That should be clear and explained to you, okay? And what are the potential side effects? You should be informed fully. That's just normal medical practice. And that's what I'm emphasizing, that normal common sense medical practice has to be resumed, started again, and it's disappeared. I'll just give a little review on what real vaccines are. These are several different pictures of viruses, and the immune response is usually against some surface component. because that's circulating in your body and your immune system recognizes it. And there are many different parts of the virus that the immune system can recognize, so that when you have an immunity, it's not just against one thing, it's against many different epitopes on the surface, so you have a robust immune response. Now, the vaccines that are the standard ones are whole virus ones, attenuated ones. They're live viruses. Let's say for measles, it's the measles virus has been changed to be not to produce the disease, but it still then will grow in you after you get the shot. The same with mumps and rubella. Another form of the polio virus is a virus that's been killed, dead virus that is given to you. Recombinant vaccines are where a portion of, let's say, the hepatitis B virus or a portion of the papilloma virus, this is for cervical cancer, is grown, and you're given portions of it, pieces of it together. And so it's not the full virus, it's just portions of it. And you develop an immune response. Now, the other viruses, diphtheria, pertussis, and tetanus, are the vaccines against the toxic product. These are not viruses, these are bacteria. The bacteria itself doesn't do any problem at all, but it produces a toxin. And that toxin, that poison, is what causes the severe diseases. And so you have an immune response now to the toxin. So if you're exposed to the bacteria, your immune system doesn't get rid of the bacteria, but it gets rid of the poisonous toxin material. These are normal vaccines. Now, I'll go into a little detail just with one disease and go into detail. All the other standard diseases have a very similar kind of a story behind them. This is a graph from the United States, deaths per 100,000 people from measles, starting in 1919 and up to 2019, and just continues the same after that. The measles was extremely common, and there was a tremendous death rate taking place until the early 50s, and then it really dropped down. The other diseases are all similar. You have a similar pattern for most other infectious diseases taking place. And I marked 1963 here because that's when the vaccine first became available. Okay, so the vast majority of improvement in controlling measles had nothing to do with the vaccine. It was public hygiene. And I remember it was in the 50s, in this time period, in grammar school, elementary school in Toronto, and you wanted to get a drink of water, in the corridor was a fountain, a faucet with a glass. You poured water into the glass, drank it, put it down, and everyone used the same glass. Now, you think of the public hygiene sensibility of that. And that's why measles was so common, all the other diseases were so common. It was very important to recognize that that at this time period, as the vaccine is being introduced and starting to use across the country, it's not zero. It still was producing 300 to 400 deaths per year in the United States. Now, by population growth, if you just simply got rid of all the measles vaccines, you'd expect 500 to 600 deaths per year from measles, okay, just by not being immunized. Now, so the vaccine did produce this effect, and it's basically been zero deaths. So the vaccine did have an effect here. Okay. The other thing from this graph, which is a really important one, which you have to really think it through a little bit, measles was very common out here, even into the 50s. People knew what measles was and what it produced and how bad a disease this was. For the past 70 years, it hasn't been around. We don't know what measles is. Measles, no one's seen it. Well, it can't be a problem, can it? Well, quite wrong. Measles is a very bad disease. And I'll just give you now, this is part of the informed consent. You have to know what it is you're trying to control here. Measles, and this is basically mostly in children, produces pneumonia in 4%. 4 out of 100 kids will get pneumonia. Needs to be hospitalized for it. That's not good. Okay, eye infections, 5%, corneal ulceration, 1%. Some of those will lead to blindness. Ear infection and deafness, 8%, some degree of deafness, including total deafness, 8%. 8%, 8 out of 100. That's nothing to sneeze at. Death rates, 2 per 1,000. That is substantial. If you think about it, comparing it, COVID went through at the very beginning when it's the worst, the bad. Children were not affected very much by COVID. How many children died from COVID during the first waves of it? Very few, less than 2 per 1,000. Measles for children is worse than the worst form of COVID. Now you'd say, oh, this is old data. This is from the 50s or something, but now we have better medical care, everything. No, wait a minute. That virus that spread in Texas just this past year crossed the border into, same measles virus, crossed the border into Mexico. And in Mexico, they had 6,000 cases with 21 deaths. Okay, 3.5 per 1,000 deaths. That's just now. That's just half a year ago, 2025. You could say, well, okay, Mexico, they don't have good medical care compared to you, but still, that gives still strong support to a minimum of 2 per 1,000 deaths. This is a very, very bad disease, measles. In addition, encephalitis, when measles gets in your brain and kills you, 1 in 1,000. Post-infectious encephalitis, 1 in 1,000. This is 6 to 7 days later. An autoimmune response takes place and the child's brain gets damaged. Some of these die. The ones that don't are left with permanent brain damage. So, and it can be very severe. So 1 in 1,000 chance of permanent brain damage. That's no joke. And the worst of the worst is this one, even though it's 1 in 10,000, but this is the worst heartbreaking thing. Subacute sclerosing panencephalitis. The child gets measles, recovers, everything's fine for 6, 7, 8 years. And then the child's brain starts to degenerate. Progressive, nonstop. In a year to 2 years, the child's dead. And you see that your child disintegrating. And the exact reason why this happened is still not known. It doesn't happen anymore because of the vaccinations. But this is a horrible thing that you don't want your kid to have. Okay, so that's the disease. It's pretty bad. For children, it's much, much worse than COVID. Much worse. Okay. What are the side effects? You need to know what's the bad side effects. Well, you'll have about 10%. This is a live virus. It'll spread in your body, and you can develop a fever from it, sometimes a rash. You're not going to get measles, but you're going to have a reaction. Sometimes kids will have fevers and spike fevers, so 10% chance of a fever and a rash. And sometimes when the fever spikes, you'll have a seizure, a febrile seizure. The chance is 1 in 3,500. These febrile seizures do not produce any permanent damage of any kind. They're scary and a nuisance, but you get over it and everything is okay. Decreased platelets, thrombocytopenia, 1 in 100,000. Encephalitis from the vaccine, extremely rare, less than 1 in a million. So these are the pictures of what side effects of the vaccine. When you compare the disease to how little side effects there are, I think every responsible parent will want their child to have the measles vaccine, and I would certainly recommend all kids get the measles vaccine, the full MMR. Now, the one thing that I did not include on that side effects is this issue, which is really a very important one. And I'll just give you the final result right now. I could fully explain my arguments, but it would take another lecture, another hour to go through all of it. There is a very strong correlation between vaccines and autism. Very strong correlation, but it's not causation. Vaccines do not cause autism. That's my result, and I do have a lot of experience treating autism and autism clinics in the United States and Canada. I've treated about 500 kids, families with it, done a lot of research in it. But to fully explain why I say that would be a lengthy discussion, so I'll get into that now. One thing that's not been looked at is the cumulative effect of vaccines. Kids get a lot of these things, up to 72 during childhood. And is there a negative effect from that? That has never really been adequately looked at or investigated. Now, to do a study, the really best way to do this, called placebo-controlled, and where you assign randomly. One will get the medicine or vaccine, one doesn't. and they're randomly assigned, and you then follow them and see what happens. You do in such a way that the researchers don't know what's being injected, what's being done, but this kind of a thing has never been done with vaccines. But you can do retrospective studies, and I'll get into some retrospective studies with you that are really of high quality today. But the ones with cumulative effects are not good studies. They're not good studies. This one is the one that received a lot of attention recently. It was done 5 years ago at Henry Ford Medical Center in Detroit. And they looked at vaccinated versus unvaccinated children over a 5-year time period. And it's never been published officially. The authors did it and then decided not to publish it. They're afraid their medical careers will end because this suggests vaccines are bad for you. So they don't want to risk it, but you can get the full article online. Just Google it, you'll find it. It's available to study it. And this is a very good study that they did because they provide the full information and you can then figure out where the limitations are. Other studies that are done only provide a fraction of the information and you just can't accept it as what they've written. This one is very good. And what they did is a retrospective study, and over a 16-year time frame. 10% that were not vaccinated, 90% were vaccinated. And following up over time, the ones who received the vaccines had 4 times greater asthma, 4 times greater, almost 5 times greater autoimmune disorders, neurodevelopmental disorders were almost 6 times greater, ear infection 7 times greater. Now, other studies that have done that are similar in methods reveal similar findings. But what they included data, which is critical data, is this. If you're comparing groups, you want them to be similar groups. If they're completely different, you can't compare results. Giving a vaccine to 20-year-olds is not the same thing as giving a vaccine to 60-year-olds. For looking for effectiveness, the different things, you're mixing things up. This study, the ones who were vaccinated, the kids on average had 7 visits to the pediatrician's office per year. To me, that sounds kind of absurd, number of visits. Not vaccinated, 2 visits per year. These are different populations entirely. And I think a lot of this is just common sense how this could happen. You have families, very simply, where a child gets a snotty nose. And the parents will say, okay, it's a snotty nose, you're fine, no fever, drink some extra fluids, you'll go back to school, you'll feel better, go to school tomorrow. Another family will say, oh, I don't know, this could be terrible, we've got to run see the doctor. You run to see the doctor see, okay, everything's fine, doing extra fluids, the outcome is identical. But what happens, the doctor cannot, on the medical record, say everything's fine. For billing purposes, there has to be a diagnosis. You won't get, if you say everything's okay, you get nothing. 0 money, nothing. There has to be a disease. So now you have allergic rhinitis. You have allergies. And if you have a cough, all of a sudden now you have asthma. So now just by walking into it's not that the doctors are doing something bad, it's just that the method of collecting the information is based on billings, not on diseases. And the billings and diseases may not be the same thing. Now, the other thing that happens, it's the billing codes are the thing. The other thing that happens is that if you see doctors walk into the clinic, oftentimes the first question that's asked, have you had the vaccine? You should get the vaccine. Why didn't you get the vaccine? Okay, that's for children. Listen, I have a lot of medical problems. I've been here for a year, and I've seen a lot of doctors here in Michigan City. Every time I go into the doctor's office, have you had the vaccine? Do you want the vaccine? For me. They're pushing it all the time. And you can't go into Walgreens pharmacy without vaccines here. Okay, so let's say your child has attention deficit disorder, which is fairly common. By law, you have to have a new prescription every month. So you go in to pick up your prescription. Did you have your vaccine? Okay. pick up the next one, pick it up. Did you have your vaccine? Did you have your vaccine? Well, eventually you'll say, well, give the vaccine and just stop bothering me about this vaccine. Okay, so this vaccine pressure is constant, so that ADD kids, now all of them get vaccines. And so it's not because of the vaccine causing ADD, just because they're seeing the doctors every month, you know? So now in the Henry Ford study, there's another aspect to it which is critically important. When you compare the vaccinated, unvaccinated group, there's no difference in serious diseases, serious ones that, you know, a parent isn't going to simply say, oh, you'll get over it, you know. Cancer, autism, diabetes that requires insulin, these are the same. The vaccination had no effect on the really serious diseases. That argues, again, gives supportive evidence for what I'm saying. So that if you want to look at the cumulative effect, does it have negative impact, you have to do studies, you know, very different, or very carefully select your data. Now, in Fort Wayne, Indiana, there's a woman named Ashley Grog. She's a nurse in active practice. She set up an organization called Hoosiers for Medical Liberty, and she's come up with a proposal that she's already submitted, basically to Indiana Department of Public Health, to request that there be a data review in Indiana. We have all of the vaccination records are available. All of the medical care children receive is available. So it may be possible here in Indiana to dig through in a correct fashion and to do a good retrospective study as possible. So she asked me to letter of support, so I did that, I provided it, and hopefully something will be done here to gather that kind of information. Now, again, informed consent is important, I think, not mandates. I think people need to be informed about what's being done and not simply commandments given from God, you know, as academics like to do. There's a House bill in Indiana just a month ago submitted. Congressman Bruce Borders of the 45th District in Sullivan, which is just west of Indianapolis, that would prohibit vaccine mandates in areas of employment that will particularly affect hospitals and medical care systems. And then in the Senate, Indiana Senate, Senator Tyler Johnson is also a physician. He's from the Fort Wayne area. That is a more comprehensive thing. It's an 85-page bill, but it would get rid of mandates for all vaccines. So I strongly support these. These were just submitted a month ago, and hopefully some progress will be made at some point with these proposed legislations. Idaho has gotten rid of vaccine mandates entirely in the state. Florida is still in the process of doing that, and I support those things. Now, I mentioned what vaccines are, the standard ones, how they're developed, and what they are. This is the COVID material. It's not a vaccine. It's a genetic product. The messenger RNA that only codes for the spike protein, which is the little pink things here sticking out on the surface of the virus. Now let me explain to you what this is. The genetic information is contained in the DNA of the cell, all our cells, okay? To get that information from the DNA out, to produce proteins in the cell and to have the effectiveness, the information is transcribed into RNA, messenger RNA, which leaves the nucleus, goes into the cytoplasm, and then the messenger RNA here is used as a template to produce the proteins. That's how it works, okay? All the general biology. Now, here is the RNA from the COVID-19 virus that codes for the spike protein. It's mass-produced, put into nanoparticles, okay, and then injected into you. This injected nanoparticles then go into your cells, take over the metabolism of your cells. Your cells then produce the spike protein, and then your immune system sees the spike protein and produces an immune response to it. So that's how this works. It's actually genetic material. It's not the COVID. Now, this is the messenger RNA form. You can do COVID vaccines in a normal fashion, and they do exist. Novavax is one. It just takes longer to produce it. So there are COVID vaccines available that are normal vaccines, not these genetic ones. These are not normal. These are genetic things that have been done. Okay. It only codes for the spike protein, one thing. All the other vaccines code for immune responses against many different other epitopes on the virus. A natural immunity is going to be much more robust than the vaccine, than this thing here. I had a tremendous amount of respect for my training, both in the academic world and at the Mayo Clinic, for the CDC, FDA, NIH, my entire life. These are temples of quality medical care, above reproach. I even had 3 of the COVID shots, and I convinced people, you should get it, you should get it. And then you start realizing that things are not quite right. And when you think about what really started making me concerned was when the committee, this is the vaccine committee of the CDC, started discussing giving children as young as 6 months of age, the COVID shot. That really got me concerned. How can you do that? You're injecting genetic material. You don't really know what the long-term consequence in adults is going to be. Now you're going to give it to children as young as 6 months? Well, that made me very, very concerned. And I produced a YouTube video 4 years ago. It's still there. It never got much attention, but it's still there. If you want to see it, go back 4 years ago. It's on my YouTube channel. Basically, it's how can you do a genetic thing when you have no idea of the long-term consequences? In terms of this committee doing foolish things or anti-common sense things, when you look back at it, they have a history of it, going back in 1991. Hepatitis B vaccine. It's the only way a newborn child will get hepatitis is if the mother has it and it goes through the birth process. Hepatitis B does not go through the placenta. During the birth process, all the blood, maternal blood is there, and the child is exposed to it. Now, hepatitis, if that happens uniformly, the child will develop chronic hepatitis, short life expectancy, a lot of medical problems. It's a very bad disease to have, and it's completely preventable by the hepatitis injection in the newborn. Okay. Now, but before being born, prenatal testing, that's one of the things that mothers are checked for. So if the mother is positive for hepatitis B, then definitely the newborn should receive it. That's absolutely the case. Now, if the mother arrives to the emergency room and she's not received any prenatal care, you don't know what it is, then you better be on the safe side. And then that child should receive the shot. Absolutely. But if the mother's received prenatal care, she doesn't have hepatitis, okay, doesn't have it proven, why give the child a shot? Why? Why do you do it to everybody? Their recommendation was immediate from 1991. Everybody gets it, and everyone's been getting it. First day of life, every newborn in this country since 1991 has been getting the shot. Why? Why didn't you do it selectively? Well, fortunately, Secretary Kennedy's got rid of this. Now it's going to be selective. Sensibility, common sense finally showed up, but it took 35 years. And this committee of professors, of academicians, are there side effects to the hepatitis B vaccine? Well, it's a very safe thing, but there could be, especially then when you're adding many other shots on top of it. It's never been looked at. It's not a frivolous issue, not a frivolous concern. Fast forward to 2005. This I couldn't believe. The same committee approved combining the MMR vaccine, there's 3 components, with varicella, a chickenpox vaccine. So instead of getting 2 separate shots, which you'd have to come in 2 separate days for, they put the 4 together. Okay? Now, at the time they gave permission to use this, they knew that you have an additional risk of febrile seizures of 1 in 2,500, additional. The MMR risk is 1 in 3,500. This is now you adding on top of it. You're tripling the risk of febrile seizures. What sense of it? Why? Why are you allowing this thing? They knew it, but they allowed it anyway. If your mentality is it's more important to get as many vaccines into a person as possible, febrile seizures be damned, then fine. But I think febrile seizures, even though they don't produce any damage, are things to be avoided. I don't want my kid to have seizures. I don't think that it's a good idea. Okay, but that's just me, maybe. Thank goodness, Secretary Kennedy got rid of this. This is no longer available. It's been last 6 months ago, it was deleted entirely. Fast forward to 4 years ago, as I'm doing this video, I put my tape out. Then I realized that there actually was on that committee at that time, 4 years ago, one person who was a pediatric immunologist who spoke out against children getting that COVID shot. Exactly the same arguments that I had, exactly the same things. And what happened? He gave a television interview, which was recorded, and I saw it on YouTube, okay? It was sensible. So what happened? Within a week, he's fired. And then a week later, it's a unanimous recommendation that all children 6 months and up should get the COVID shot. So the one voice of common sense was fired, you got rid of it. And then, shortly afterwards, Google scraped that video, was no longer available, got rid of it. So censorship took place to get rid of one intelligent voice. At the same time that happened, the ivermectin issue came up. And the reason it came up is friends of mine in Lithuania contacted me, could I obtain ivermectin for them to treat relatives of theirs who had COVID? And I said, well, I don't know anything about it. I'll look into the literature. I'm very competent on reading literature and evaluating it. So online, you can get all these articles, and there actually were a whole series of articles, mostly from South America, looking at ivermectin. And these aren't great studies, they weren't very good studies, but they all showed the same thing, that the dose of ivermectin which they were given was just one dose early in the disease, decreased hospitalizations from COVID. It was effective. And ivermectin has been around for many, many decades to treat parasitic illnesses, and it has almost zero side effects. Very, very safe and dirt cheap. To treat a patient for the dose necessary for the COVID would have been about 50 cents per person, per treatment, next to nothing, dirt cheap. So I looked at the literature and I said, well, it makes sense. I'm gonna try and get it. Well, I tried. I approached one of the pharmacy distributors, one of the nationwide pharmacies that have several of the outlets here in Michigan City, actually. And when I tried to get it, the pharmacy officially made threats to report me to the Illinois authorities, to threaten my medical license. I couldn't believe it. I'm a physician. Not only do I have a license to obtain medicine, this is a very safe medicine, it's not a narcotic, but it's now banned. You can't get your hands on it. Well, I'm also a creative person. I contacted a pharmacy in Vancouver, Canada, accepted my prescription. They made arrangements for a pharmacy in India to ship me a supply to Chicago. I put it in my suitcase, took it to Lithuania, and distributed to friends and relatives in multiple cities, okay? So it got out there. And I'll tell you this, the result was no deaths from the ivermectin, despite the constant daily reports to Chicago Tribune of people are killing themselves from ivermectin, which is just nonsense. And there were several actual miraculous cures that took place with, or nearly what sounded like miraculous cures. So that shocked me. How could the CDC, FDA, NIH participate in this kind of total deception and lies? These are just massive. And then with the immunizations for children, I was shocked, and I still haven't recovered it 4 years later from it. This is the shot that's being given, okay? The nanoparticles are injected. Now, the story was at the time I received it and everything, that this just stays in the area where the shot is given. Okay, that's the only place it produces the spike protein, that's fine. That was a lie that they all knew about at that time. Okay? There were applications submitted for emergency authorization that Pfizer and Moderna did. And it was only about 2 years ago that those emergency authorization forms were released. The first country that did it, I think maybe the only one, was Australia. It would have been the same thing submitted in the United States, Canada, other countries. Australia released it. And in that authorization, they included all of the science. So Pfizer and everything had the science there. In experimental animals, when you injected this thing, it didn't just stay there. It went through the body in different organs. Not in all cases, but enough that it could affect every single organ in your body. Okay? It was known, and the regulators that gave emergency authorization is professors of medicine, professors of infectious disease, professors of immunology, completely ignored it and all proved it. Yes. It's unbelievable. CDC, FDA included. So what happens if you give this thing and circulation, it gets into your heart? Nanoparticle comes inside into your cardiac cell. It starts producing spike proteins. Your immune system recognizes the spike protein and attacks your heart. And what you get myocarditis. Aha, myocarditis. It's one of the side effects of this COVID shot, and that's how this happens. What about other organs? What about ovaries? What about testes for long-term thing? What about there? And what effect could that have for the next generation? What about fertility? In the applications, it's there. It shows up in ovaries. It does. Ignored completely, and still ignored. Now, other aspects during the pandemic, the mandates to wear masks was absurd from day one. On population levels, it's already been shown over and over again in studies prior to COVID, it doesn't work. You know, if you're immunocompromised and you wear a mask properly, you can prevent getting infections, that's true. If you're ill, it could decrease some of the transmission, but that's mask properly done, properly fitted. But this population stuff has no effect whatsoever, it's zero. It's a complete waste of money and time, but mandated everywhere in the world. And I don't know how many times, I can't count the number of times I saw this absurdity. You stand up in a restaurant, you have to wear the mask. You sit down, you can take it off, everything's perfectly fine. How absurd is that? You know, you're talking, you're spreading the viruses all over the place. Well, you stand up, no, you have to wear the mask for some reason. It's nonsense. It's beyond, it's just ridiculous. Mandatory everywhere. Social distancing, 6 feet. Where did that come from? You know, and to me it was absurd seeing, you know, during some presidential meetings at the White House, they have these big, you know, chairs put out on the lawn by the White House, big white circles where everyone's sitting, and then you have these areas, you know, just to demonstrate the social distancing and as a political, you know, stunt. Anyway, a infectious disease expert in Australia did a deep dive into this. And what it turns out, in 1912, there was a physician in Connecticut and who was convinced that you can transmit bacteria through droplets as you're talking or coughing from one person to another. At that time, still there was discussion. Do bacteria exist? Do they cause diseases? Not everyone accepted bacteria at that time, but he had accepted it. And his idea basically was that, well, these particles come out, droplets come out, and they will fall to the ground. And then when they hit the ground, that's fine. They're finished. And so the 6 foot distance is something he just made up. There was no science, no nothing. He just made it up as his idea. That's a valid idea to have, and he published it. That idea got picked up into medical books and repeated, and no one ever looked at it again. That's medical science, okay? Based on nothing. Now, he was correct that the viruses get into these particles and you cough or talk, it gets out there. That's absolutely correct, and they float. But he was wrong. They don't go to the ground. They just float, not 6 feet, 60 feet, 600 feet, until they dry up and disappear. So, so this thing is not based on any kind of science whatsoever. The farther away you are from a sick person, the better off you are. very simple, very logical. And that 6-foot thing is really nonsense. The concept of your child has to be immunized because otherwise you'll transmit to grandparents and grandparents will die. Rachel Maddow blaring repeatedly on her TV show on MSNBC, if your kids don't get immunized, they're the same as murderers, as killers. They'll kill their grandparents over and over and over again. Nonsense. There was no data to support that idea. In actual fact, when they did collect the data, getting the COVID shot didn't affect transmissibility at all, nothing. You can still transmit the disease, not even have it. It was a fake story, completely manufactured fake story. The CDC, the FDA, the NIH played into it 100%. Look at the consequences. How many thousands of people ended up in this situation, dying alone? Their families nearby can't visit them. Families can't say goodbye, and the person is dying alone with nobody near there. How many thousands and thousands of cases has happened? Completely unnecessarily. How many businesses were shut down? The big stores all survived very well because they were kept open. There's the small businesses that were destroyed. During the first summer of the COVID pandemic, I couldn't believe it. I was living in Chicago. Chicago's lakefront was shut down. And I loved to put my bike in the car, drive through the lakefront, and bicycle along the lakefront. And during that summer, it's locked down. You can't go out there. It's the safest place in Chicago. It's a beautiful summer day, breeze off the lake, sun is shining, ultraviolet lights will kill viruses instantly. No viruses. You can't possibly get exposed to a virus on these days. And I'm out there, get shut down. Police cruisers all over the place on the lakefront. Well, fortunately, some of the educated Hyde Parkers tore down some of the barricades here, so I was able to go in there and bicycle. And each of the 3 times I went, I had a conversation with police officers, Chicago police officers. Twice, I was able to convince them that my experience and everything, and they knew that this is nonsense. They let me bicycle, no problem. The 3rd time, there were 2 young guys, and I can explain my expertise and knowledge and everything. And they said, no, it doesn't matter. We can't risk losing our jobs. So I said, okay, fine. I've already bicycled 5 miles along the lakefront towards the city center. I said, fine, okay, I'll go back to my parked car. So I turned my bike around and I bicycled back along the lakefront, 5 miles back. They didn't say, they saw me bicycle back, they didn't say anything more about it. Anyway, absurdity of all of this stuff played into by the CDC, FDA, NIH played into all of this nonsense completely. Shutting down schools, what sense was this? You disrupted education internationally for kids for 2 years. And some of these kids will never, ever catch up again for what was done. This was profoundly ridiculous what was done. Now, hand washing works. This worked during the pandemic, it worked before, it works afterwards. This is really something which is correct. No, absolutely. Now, the one country that did it correct, now since I had my experience with MRSA, handling pandemic, I followed this pandemic thing right from day one, everything that was going on and what was happening internationally. I was just out of interest because I went through with this on a really intimate, life or death level with MRSA. And I knew what COVID was, how bad a disease this was. And I realized Sweden was the one country that was doing it intelligently. No lockdowns, none of this nonsense, no mandates. And their final outcome was not much different from anyone else. So there are intelligent places. Now, in Chicago, I tried calling, I was concerned about it, wanted to share that things were being done incorrectly, called the mayor's office several times. They set up appointments, no how. They never called back to set up appointment. Matt O'Shea, my local alderman, I knew him on a first-name basis. I contributed a lot to his political campaigns. Bumped into him in the Dan Ryan Woods one weekend exercising. And I said, listen, I got to see you. This is really being done badly. He said, okay, call my office. We'll set up an appointment. Well, I called his office 3 times. Each time they said, well, we'll call you back. No one ever called back. You know, they had their way, and no one's going to have any input in it at all. That's Chicago, that's Illinois. Now, I moved to Indiana, and this summer, I decided just to take a look, since Kennedy was changing the vaccine schedule. What's happening here? As out of curiosity, I looked at it, and I saw, well, there's some discrepancies here. The CDC has made changes. Indiana hasn't, and I had some concerns about all the vaccines that were being recommended. So I put a call in to Dave McCormick, and he called back. He called back. He's in Indianapolis, and he's in charge of the state of Indiana vaccine program. Now, he's not a physician, he's an administrator, but he's the guy kind of overseeing everything. And we had a pleasant conversation. I informed him about the changes on the CDC website. He said, well, I didn't know about that. I'll look into it, and if appropriate, I'll make changes. We spoke on June 4th. June 5th, he changed the thing on the Indiana vaccination program. You know, so he did it. While I talked to him, he looked into it and did it. So here in Indiana, at least, you can have intelligent conversations with intelligent people. I'm impressed. Now, for vaccines, right next to Sweden is Denmark. In my opinion, this country really has the best sensibility about childhood vaccines. They really do. They really, really do. And they've never had mandates for vaccines, ever. Never. No mandates. They provide informed consent. Still about 95% of children get vaccinated. But the vaccines that they give is not the massive numbers that was previously recommended in the United States. Much more sensible, much more limited to serious diseases. Now, Secretary Kennedy has changed the childhood vaccine program. This is now the CDC. When you look on it, it's kind of hard. This is also all of childhood, but it's massively less than what was there before. It was massively bigger before. And if you go on the Indiana website for what is the vaccine recommendation of Indiana, automatically it clicks into this graph. You see this thing. So now this is also what's being recommended officially in Indiana. So there's progress being made tremendously. Now these are the vaccines. And I agree with all of them, actually, as being important vaccines. But to go into these things, you need to give, half-hour talk on each one of them. That would take forever. The only thing that I disagree with is varicella, the chickenpox one. And Denmark does not have this as a recommendation. So I agree with Denmark more than with the current CDC. Now, the varicella vaccine came out when it was still in clinical practice, and I had chickenpox come through my nursing facilities. Now, these are extremely fragile children, extremely vulnerable. And during these chickenpox outbreaks, they were unpleasant, but nobody died. Nobody died. And these are the extremely vulnerable kids. Nobody died from it. Now, if you give children a vaccine, vaccine effectiveness only lasts 6 or 7 years. So basically what you're doing is you're pushing off chickenpox from childhood into adulthood. And then if adults get chickenpox, that can be very bad. You can get pneumonia and die from it. So why do vaccines for convenience, but produce serious illnesses, including death in adults? Why do it? That's why I'm very much against the varicella vaccine at all. And so I would remove it. But that's my rationale for that. But otherwise, I agree with all the rest of these things that are currently not recommended by the CDC and in Indiana. Now, let's backtrack. Children and the COVID shots. Okay, this just came out. This is data, some final data being presented, being pulled together. People are addressing this issue because it took so long because of fear. Because if you say anything against the vaccines, you're going to have your career destroyed. Okay, and that's no joke. That's neither for the people who want their careers done, nor for the demagoguery that's actually in place, which it actually is. This was published in the journal Epidemiology not even a month ago. Okay, it came out. Latest information. From the United Kingdom. This is for children now, and they looked at the COVID shot. It's a retrospective study, not retrospective study. But if you have enough data, you can dig through it and make it a good study. And that's exactly what they did here. And what there were is that there were 64,000 children who did not get the COVID shot. But you had 800,000 kids in the total population. If the question is, did the COVID shot prevent COVID deaths? The answer is no, it didn't. Okay? Nobody died. So how can you prevent nothing when there's not deaths taking place? So it didn't work there. But the COVID shot did decrease the number of hospitalizations from COVID from 60 to 36. Okay, now ICU admissions for COVID, 3 with no dose, 0 here, so that the COVID was produced a little bit more illness. But remember, data, we're talking about numbers 60 and 30 when you're starting off with 64,000. So how much good are you doing? Really, it's not that much. But look at this thing here. Pericarditis, myocarditis, 15. And none here. That's clearly from the COVID shot. And what I think is that this is really an underestimate. Now, these are people who were diagnosed with it, okay, who had symptoms, and they came in for checkups. And there was going to be a lot of them, a lot of kids who had mild symptoms of pericarditis, myocarditis, never saw a doctor. But more important is, you've heard, I'm sure, in the news, gets the COVID shot, a teenager goes out on the sports team a day or two later and drops dead. Why did they drop dead? Most likely myocarditis produced a cardiac arrhythmia, and the heart stopped and they died. Those cases don't appear here because they're dead. So we should have another category here. Deaths from COVID immunization, okay, which is not here. So the number will be here, it'll be small, but it will not be 0. It will not be 0. So do you want your kids to get the COVID shot? I think this is very strong, very, very strong evidence not to give children the COVID shot at all. Now, another issue about, I'm sorry, a little bit out of focus here. Now, there's DNA contamination in the mRNA production. Particularly of concern is SV40, simian virus 40, which is an oncogene, which produces cancer. This is something that's known about. This is an unfortunate byproduct of the production. Pharmacy companies monitor it, try and minimize it. And so how much problem it produces is uncertain, but if it does, it's going to be small, I think. So, but it's a definite concern. But a bigger concern is a different process, which I don't see anybody researching or studying it at all, which they should. I don't understand why this is not happening. In the normal process, as I mentioned, DNA information is here, is transcribed into RNA, which then is used to produce proteins. But there is a process called reverse transcription, where the RNA can be transcribed backwards into DNA. So here you have the virus RNA being transcribed into DNA, which then gets into your DNA. And where does it go? Who knows? Could it go into places where it produces cancer, for example? It could. No one's looking at this question. No one's researching it, to my knowledge. But to me, it's just an obvious thing to look at. You should. But then there's still a massive amount of censorship taking place with anything dealing with COVID or with this process. Okay, just this article just came out. This is just really recent information that you're getting here from South Korea. They looked at a population of 8 million. These are gigantic studies, 8 million people. 500,000, no vaccine. Now, again, this is a retrospective study. But if you have very large numbers of people, you can then retrospectively match, make them a matching thing. Here they matched 4 to 1, 4 times. For every one person that had no vaccine, they matched by age, sex, social demographics, other illnesses. They matched 4 others. Okay, so that would be really, the statistics would be extremely robust. And guess what happened? This is 1 year after getting the 1 COVID shot. Those who had the shot, 33% bigger incidence of cancer. Now, these are all cancers added together. 33% bigger chance of cancer. And this is the first report that I know of with this looked at this thing. This could be easily done in other countries, other places. Why hasn't anyone else looked at it before? Well, maybe somebody else will. And as I said, this is the first time. Now, another thing that's been noted and has been going on for years, and that was excessive mortality. We have death rates going before COVID, the night 2017, 2018. Okay, so we know what to be expected in terms of death rates. But there's been excessive death rates taking place. Now, a lot of this, and these are different Western countries, and when you have the COVID come out, you'll have big spikes of death from the COVID. Initially very big increase in excessive death rates then, but then it continues. Excessive deaths continue. And it's about 10 to 15% increase above baseline. It continues up to today. But COVID isn't doing the killing anymore. But why is that? Could it be these shots that everyone's received? Now, these are deaths from everything, not from any specific cause. But when you think that those nanoparticles went through your entire body, or could have gone through your entire body, all organs, and could have affected any and all of them in unknown ways, it's not surprising that this could be the cause of the excessive death rates. Okay. To research this thing, no one's going to touch it. No one's touching it, really. The only thorough study that I saw was a group of statisticians in Finland about 1.5 years ago. Looked at it, but no one in the medical world's touching it. This is just very recently, the Japanese Medical Association journal, looking at this question, and in the article itself is a very strange article. It's a very brief one, but it gives no numbers. And it says here that the Japanese excessive death rate is 3 times bigger than the US excessive death rate, but they don't give any numbers. They don't give anything to compare to. Okay. And in the article it says, well, maybe the COVID injections had something to do with it. Maybe somebody should look at it. Well, maybe they should have simply said something like that more definitively themselves because they were looking at it. But they can't because they're afraid to have their necks chopped off. Okay? But look at the title of this thing. The title gives it away. Significant increase in excessive deaths after repeated COVID-19 vaccinations in Japan. Well, the title gives away what they're thinking, but they can't say it in the article themselves. Self-censorship. Now, these are 2 organizations which, to me, is appalling. I just can't understand this at all. American Academy of Pediatrics, 65,000 pediatricians in the United States belong to it. They're strongly recommending COVID shots. They're strongly recommending the old full panel of all shots about everything to all kids all the time. To me, it's appalling. There is no concern for health of children that they're demonstrating. This is a purely political organization, purely run on political things. Pharma benefits from these kinds of ideas. And to me, it's just astounding that they can do things like this beyond any kind of common sense. Possibly worse is the American College of Obstetricians and Gynecologists. These are the people who are the doctors in attendance on giving birth to children. They're recommending pregnant women get the COVID shot. How can you conceive of something like that? You can cross the placenta, get into the fetus, and you have no idea what kinds of genetic things you can cause. You have no idea what the potential side effects are, but they're actively recommending it. To me, it's just blatant malpractice. Now, we'll skip out of childhood into adulthood. The flu and the RSV vaccines, which are being, at least this season, pushed a lot around here. The big studies of flu vaccine effectiveness in the United States were published in the late 1990s. The latest big one was in 2003. And the results are pretty much similar in all of these studies. These are observational studies. They brought the flu out. Some people got it, some people didn't. These are not controlled studies at all. And they looked at outcomes. And in this particular study, published in 2003, gave results which are similar to the other previous studies, but they're observational studies. And hospitalizations for flu and pneumonia were decreased by about 33% reduction if you got the shot, if they're for elderly people. And the deaths were from all causes, about a 37% reduction in deaths. So there is a kind of effectiveness in elderly people to prevent hospitalizations and to preventing deaths. But these studies are limited. They're very limited. And to me, and these were done. Data was collected 30 years ago, and eventually published 25 years ago or more, most of them. And what's very strange to me that they couldn't separate out. Were you hospitalized for the flu, or were you hospitalized for another form of pneumonia? You should be able to sort that out if you're doing a medical records review. In some cases you may not be able to tell, but most cases you should be able to. But they lump all causes of death together. What about those who died from flu, those who died from a stroke or from other things? You should have been able to separate these causes of death out. But even more striking, they never even looked for side effects. No mention of it because they didn't even look for them. Now, elderly people have all kinds of medical problems take place, so it may be very hard to sort out vaccine side effect from that would have happened otherwise, but it was not even tried to do it. So there's limitations to these old studies, very big limitations. Now, one aspect of this stuff was addressed in these two very, very large studies, which just came out in December, 2 months ago. One's from Denmark and one's from Spain. These are a flu vaccine given to 65-year-olds. And what they looked at, they divided, it wasn't a randomized control, but they were just randomized to receive either the regular dose or a double dose to see whether there's any difference in outcome. 300,000 cases in Denmark, 100,000 cases in Spain. So these are very, very big studies, very substantial. But there wasn't a third, there should have been a third group. No vaccine. Really should have been a third group. Now I'll get to you why this was a really big mistake. The next slide will show you why this was such a big mistake not to do that. Now the results were this: hospitalization for flu or pneumonia. There was no difference whether you got the regular dose or the big dose. Everything was all the same. But the hospitalizations for flu or pneumonia with the shot was one per 1,000. Okay, still people got the flu. The flu vaccine doesn't guarantee lack of flu, 1 in 1,000. Serious side effects that the researchers thought was definitely due to the vaccine, definitely due to it. 40 per 100,000. Now, I've used that 100,000 number as a reference. 50 years ago, during the swine flu pandemic, 4 million Americans received the swine flu shot. It became clear that Guillain-Barré syndrome was taking place. Guillain-Barré syndrome is where you get paralyzed in the body. Most people recover, some not fully, some don't, they die. It's a very, very bad illness to have, very, very bad. Okay, 1 in 100,000. The FDA decided this is too dangerous a vaccine, we have to get rid of it, and they got rid of it. Okay, so here at 1 in 100,000 is not acceptable, but 40 per 100,000 is fine. Anyway. Now, this is where not doing the control group was really a big mistake. This just came out 2 weeks ago. Cleveland Clinic just published the last flu season. This is now not dealing with older people. This is dealing with their employees. There's 53,000 employees. 80% received the vaccine, 20% didn't. And they're all employees there. They're getting all their medical care so you can follow them up 100% accurate information about them. Okay? And this is what happened. Those that received, this is now 6 months out, half a year out, those who were vaccinated had a 27% bigger chance of getting the flu. Bigger chance of getting the flu. If you didn't get the flu vaccine, you had less chance of getting the flu. That is astounding. In the article, they don't get into any discussion about why this happened. They don't get into that. I don't have any explanation either for this thing at all. But it's very interesting. So that's why a placebo group is really important with vaccines. I think this really shows it. You really need when you're ever doing any other studies, you need to have a placebo group. RSV, this just came out about a month or two ago in older adults, and it's being pushed around here. You see signs for it. It just came out. 131 patients in Denmark. And now this was just randomly assigned. There's a prospective study. They divided, half got the vaccine, half didn't. Okay, now if you're going to say the RSV, question is, does the RSV vaccine prevent RSV deaths? Answer is no. Nobody died from RSV in the study. There's 131,000 people, okay? So it made no effect there, but it decreased RSV hospitalizations. If you did not get the shot, 6 in 10,000 chance of being hospitalized. With the shot, 1 in 10,000 chance. But again, according to what they felt, there were definite vaccine-related serious side effects. 1 in 10,000. Pericarditis, inflammation of the heart, hepatitis of the liver, Bell's palsy, paralysis of the face, Guillain-Barré syndrome, 1 in 10,000. So now you have the information about RSV. If they want to give it to you if you're elderly, you'll decrease the risk of RSV hospitalization, but now you're going to have a risk of a serious side effect, 1 in 10,000 chance. But RSV won't kill you anyway, whether you get the shot or not. So now you have the information and you can make an informed consent. And just finishing up, informed consent I think is very important, not mandates, and that's where the proposed legislation in the Congress and the Senate of Indiana I think is very important. Well, thank you very much for your attention. If there's any questions, I'd be glad to try and answer them.
I'm glad I'm not vaccinated.
Are there any questions?
I have one.
Yes?
You mentioned dementia earlier, that you've done studies on dementia.
Dementia? In terms of vaccines? What's your specific question?
No, not necessarily. No, you mentioned that and that caught my attention because I'm dealing with that right now. And what's the cure?
For dementia? Well, that's unrelated to it. We can talk afterwards privately if you don't understand what you're referring to. Any questions at all?
I saw a talk with a physician named Patrick Sood, and he attributed the recent childhood cancer situation where it's rising to the COVID vaccine. He didn't offer any research.
The only thing that I know of looking at cancers and the COVID shot I showed you from South Korea just came out very recently. So this is something that people are starting to look at. Theoretically, could that happen? Of course, yes. The data that I show here, I think, is a genetic framework for how this can cause cancer. Yes, absolutely. Did it cause it in this particular case? That's something that other experts would have to look at and to decide. And I think there's ways of doing it. You could look at the genetics of the tumor and see whether there's any evidence of the COVID genetic material. Then I think there's ways of addressing it, but that would be the physicians in charge of that child.
Yeah.
Oh, yes, sir.
Have you noticed any other side effects from the COVID vaccine that people are starting to notice as time passes on, like other issues, like with immunity or just other issues?
Well, we're talking, the one thing I think that I've seen a lot of people is with a kind of like there's the like chronic fatigue syndrome after COVID, but you can get that after the shot. Can produce a kind of a long COVID syndrome, a long COVID vaccine syndrome, the same kind of phenomenon. So that is something that can be very, very affect a person's life very, if you're constantly tired and falling asleep, will affect you at work and your personal life a lot. So that's a very real one. In terms of other diseases, that's something that should be looked at, but it isn't. And I think researchers are just afraid to get anywhere near it, because if they start looking at it, it could be suicide, professional suicide. And that's why so little, there should be a lot of work being done. Very little is being done. Any other questions? Well, thank you very much. Oh, I'm sorry. Okay.
Which is pertinent to vaccines. You mentioned that there's a correlation but no causation between autism and vaccines. And I'm just wondering if that's because you're in the industry. But if I'm looking at it and I have common sense, I would say, yeah, it's causative, but I'm not going to lose my job. So I can't really ask you, is that why you're saying that? But, you're talking about common sense.
Well, well, maybe I'll get into it a little bit, not fully, but to give a full discussion would take a long time. I've run autism programs in Canada and in the United States, and spearheaded some research programs in neuroimmunology of autism. I have about 8 or 9 peer-reviewed publications about my research, and spearheaded the first time in the world's history a unique immune therapy program, which was successful treating autism in some select cases. And that's been published material, so that's all available. So I do have a lot of expertise, both research and clinical experience with autism. Now, there is about 1/3 of the families that I saw have the same story. Their child was perfectly fine until about 18 months of age, developing, everything's growing fine. And then they came in for vaccinations and shots, and then come home, and then within days or weeks, there's a change in personality, and the child gradually becomes autistic. This can take place over days, take place over weeks, longer, become autistic. And in these families, autism, they're 100% convinced that the vaccination caused the autism. And I've had at least 100 families that I've seen with exactly that story.
How can you not come to that conclusion?
So that there's a correlation, a complete, definite correlation. And the other thing I had to mention is that there's many different causes of autism. It's not like one cause. There's not autism is not one flavor. It comes in many different kinds of flavors. So there is these. Let me finish. So there's a very strong correlation, extremely strong, that families have seen, many people have seen, that somehow in the academic world is ignored. Now, I did not ignore that. That's what triggered me. Why is this happening? Can we intervene? Can we do something? That led to all the work that I did, setting up the clinical programs and everything. And the way I look at it is that in these cases, this is an autoimmune attack. The person develops an autoimmune attack that attacks the brain and produces the autism symptoms, autoimmune process. And that the vaccine triggered this autoimmune thing to take place, okay? And that if the child did not have the vaccine, it would have happened anyway. It would have been not exactly at that time, some other time period. There would have been an injury, there would have been a flu, there would have been a cold, something else happened that would have triggered this autoimmune thing that would have taken place. The best best studies by far looking at vaccines and autism are out of Denmark, because they have a very long data center. And they were the last country in Europe to make recommendations about vaccines, and they have centralized data. And before starting vaccines and after vaccines, there was no change in autism frequency at all. I'm talking about solid studies here from Denmark. And they let me finish. They also had continue update, where 5% don't get vaccinated, and they periodically update, and there's no suggestion whatsoever. And in terms of the community studies that were done, Henry Ford study is the one that shows no difference between vaccinated and unvaccinated in terms of autism, and that's the one study I think gives an awful lot of data. Now, in terms of any other things, as I said before, Amish, I need to see the studies, where that information is coming from, because you're dealing with a very different population. And I'm very critical when I look at studies and evaluate it. So I'd be glad to review it, but I don't know of any studies looking at that specific question.
Thank you.
Thank you. Yes. Yes. I'm sorry. Question?
Yeah, I have a question.
Yes.
About in the same time period we had the COVID shots, my red blood cells, and there's 3 of the common measures, I'm dropping 2 or 3 points. Doctor's been looking for it. We tried all sorts of blood tests, said bleeding somewhere, can't find anything. Could the COVID have been causing that?
Well, I can't answer that question. You know, the COVID, as I say, may have gone through your entire body and affected anything there. So I can't answer the specifics in your case, but theoretically, yes, in some fashion. But I wouldn't be able to give any specifics about it. It's out of my area of expertise. Yes? Mm-hmm.
Question about the origins of this COVID. Do you believe there no or anything, did it actually come from a lab, or did it come from the infected bat? Like, did it been?
Well, I was following this very closely because of my experience with MERS and handling it, and very interested in it, and following all the information as it was evolving over time. And to me, it was blatantly obvious, right, very early on, that this was from a laboratory in Wuhan. One thing geographically, how can you, the Wuhan lab was just a mile or 2 away from where this outbreak took place. It's right there. They're doing research on coronaviruses. It's right there. And they're doing gene amplification. It's right there. Modification and strengthening the genetics of virus is being done right there. And just a mile or 2 comes over there geographically. Boy, you'd have to have some very, very strong reasons not to believe it. But what really did it is that as soon as the COVID virus genetics was deciphered, all the code was taken, it was taken to a geneticist in Paris. I forget his name. He's the guy who got the Nobel Prize for decoding the HIV genetic code. He got the Nobel Prize for it. So they brought him this thing. He went through it, looked at it, and then gave an interview in the Paris newspaper, La Presse, which is in French. A version of it was translated in English in the Telegram in London, where he said the modifications in this virus are very specific, and a whole host of them that were made that are made much more pathogenic for humans. Several of them, and they could never have happened. This was a manufactured virus. He said that, and so that really convinced me at that time. And then eventually, you end up with a letter being, I think, from Nature, published by the 2 leading virologists and immunologists in the United States, the top people in the world, saying that this was a natural form phenomenon. It wasn't a lab leak. So you.
Take COVID vaccine.
Oh, wait, let me wait a minute. Let me finish. Well, let me finish the answer. So they published this article, which then had a tremendous influence because of the name and reputation. Well, it turns out, subsequently find out, one thing, a month later, both of them got $6 million NIH grants for their research labs, both of them, $6 million each, within a month after publishing this article. And then it becomes clear that that article was partly written by Fauci, and he edited it, and he changed it, and that there were communications between Fauci where they originally did not agree with that idea, it is natural. But they were then convinced. And then their article was then changed by Fauci to make it. This was a totally manufactured study, which was totally false. And they got a lot of money. And that's where we end up with this endless thing. Now, there have been many CIA, FBI, done investigations, and pretty much everyone agrees that this was produced in the laboratory and then accidentally released.
So, second part of the question,
Okay.
how has a voice changed? Is that part that's where it was designed to change, or how did it mutate?
I don't understand in terms of
They would say that this one form and then it mutated into something else.
well, viruses naturally change. They always do. They all do. Yeah, there's just changes in the genetics takes place and rearrangements take place in the DNA as it evolves. And viruses in general become less and less severe. If viruses stayed really bad and killed everybody, eventually the virus will die itself because there's nobody left to infect. So they naturally become milder, and this way they can spread further and further and further. So that naturally, so that as the COVID pandemic went on, it became milder and milder. Now it's nothing more than a cold. And there's no reason to check for COVID at all. It's nothing more than a cold type of a symptom the way it stands right now. Arvind, you had a question?
I had a question. If you yourself, doctor, took this COVID vaccine, if so, why? Or if not, also why?
I'm sorry, I don't hear it.
I mean, when there was this pandemic and everyone had to stay at work, to get employed or pass certain gates or something, you were supposed to get a COVID approval that you got this vaccine. So my just a simple question is, did you take this vaccine?
Yes, I did. At that time, I thought, I believed in the CDC, FDA, and I believed that these were honest organizations. At the time, I did.
At that time,
At the time, yeah.
in the situation.
At the time in the situation, I thought they were being honest. But all of the things that then eventually find out, I had 3 shots, 3 of them. And I suffered pericarditis, and by that my pericarditis has nothing influence on my opinions I presented today at all. But it's after that when I started, when they were going to give it to 6-month-olds and ivermectin, and I started looking into it more and more, and you start realizing, wait a minute, this is something is tremendously wrong here.
And then again, in this conversation, was it your own choice, or was it like just you had to follow the rules, and did it harm you? You mentioned that it kind of harm.
Yeah, this was my choice. I did it, my choice, and I argued to my friends and relatives to get the shots at the time. I believed the information that they were saying was true, which ended up being false all along. And only later did I find out, and I did, and I did suffer a cardiac side effect from it.
I have a quick
Yes.
question. For people that are 65 and older, so what would be like the main vaccines that you would recommend for people 65 and older? I mean, the most important ones, or ones that would help the most?
Well, the ones that are recommended are the 2 of them, the flu vaccine and the RSV. And I went into detail about the benefits and side effects of RSV, so you have to decide on your own. I haven't had a RSV shot, and I never will, and I'm over 60, in case you didn't know. In terms of the flu vaccine, I think a lot of work needs to be done. The Cleveland study was stunning. Now, this is not elderly people, this is younger people, but I don't see why it wouldn't apply. So that throws a big question, should you get the flu shot at all or not? Is it going to make you sick? You know, that really is a problem. I didn't pull up another thing. There was a separate study done, which is not going to be approved at all for US use. It's a mRNA flu shot that Moderna developed, that the data of which was published. And that really makes more people sick than what it prevents in reality. So that kind of a thing. And based on that, it's not going to get FDA approval at all. So that's not even going to show up. But in terms of the regular flu shot, I already showed you the old data is that it decreases hospitalizations by 30%, deaths from all causes by about 37% in elderly people. So, but what are the side effect profile? And is that actually accurate or not? And now with that Cleveland Clinic showing that in some populations the flu vaccine makes you get the flu, you know, you wonder, you know. And there are some side effects uncommon, but it does happen. So it's a matter of, I think, personal choice. So, you know, I know what I do and don't do, but I wouldn't want to make recommendations. I would just want to give the information so you can make informed decisions.
One more quick question. We have both had gotten the shingles vaccine. Is that something that's recommended or?
Well, it's up to you. You know how you decide with your decisions with your physician how you want to do it. You'd have to know what the benefits, risks, what are. I haven't done a deep dive into the shingles vaccine, so I can't specifically give you any numbers or anything. But it's a matter of personal decision. Again, you should make informed decisions. Now, one thing that's really very good nowadays in the information world, you can get an awful lot of this information by doing Google searches. A lot of the stuff you want to, you know, don't necessarily have to make a doctor's appointment. Oftentimes the doctor won't know, you know, the reality of data, but you can get a lot of information just from online searches yourself. I haven't had the shingle shot myself, but I did have shingles. It's not fun. It's not a fun thing to go through, let me tell you. It is not fun. It'd be nice to avoid it.
Yeah.
Yes, huh?
So if we having had the initial batch of COVID shots, and now we come down with COVID, should we be asking to be treated with ivermectin, and would that even be possible?
Well, I'll tell you my personal view on ivermectin. It's a very, very good antiviral. I take it all the time. Last weekend I got sick with the flu and I took it. And instead of being a 5-day illness, it was a 2-day illness. It works. And the dose is small, no side effects. So, you know, that's just my personal thing. I can't recommend it because I don't think your doctor will prescribe it for you.
So I had a student who worked on the Mercy ships, and she said, if I ever get it, forget about taking the stuff that they're saying, and call me, I'll tell you what works. And so I think that she was aiming at something like the ivermectin or something like that.
Well, ivermectin's very good. I just had a couple of shipments leave my house for Lithuania for distribution in Lithuania, where you still can't legally get it, but people out there have been using it very effectively, just as I am. So I think it's a very, very good. It's very safe. And it used to cost 25 cents, 50 cents per, now it's about $25, $30 per treatment. so that they're making money off of it. But it's not so simple to get it, but you can. It's no longer blocked like it was before.
That's actually what I was going to ask, was how available is it on the market?
It is available. It's just that will the pharmacy give it to you? If you say you're not going to submit it for insurance, that makes it a lot easier because insurances will not cover it in general at all. So you have to say, you know, the prescription, but no insurance coverage, so that you can get it then. That's how I get it.
What dose do you take?
Pardon me?
What dose do you take?
What I take myself are 6 3-milligram tablets. That's 18 milligrams, and just once a day. Usually, one early. You take it early in the illness, as soon as you know you're sick. Not just when you're sort of feeling a little off, but when you feel particularly early on. And then if the next day you're not improved, take it a second day. And usually that's all you need. You don't need a third day. I wouldn't go more than 3 days. But that's for my size. Now, I think that works out to be like 200 micrograms per kilogram or milligrams per kilogram, something like that. So for my size, it's 18 milligrams, 6 of the 3 milligram tablets.
I think you can get it from a veterinarian.
Yeah, it would be the same quality, absolutely. Any other questions? Well, thank you very much for coming. Thank you for staying so late and for having so many questions. I really appreciate your attendance.